Our first article encompasses the idea of telehealth in the context of cystic fibrosis or CF. Maintaining CF is very intensive and demanding, including a daily regimen and regular outpatient visits for monitoring. But now, home-based health monitoring is being looked into in order to facilitate long-term care. Put together, these devices can record info and patterns to inform patients and clinical teams, but there has to be some kind of consensus understanding of the patient's current state in order to successfully implement these technologies. With the idea of good chronic care cycle, a common theme of integration arises because the connection between home and clinic-based care is important in chronic disease management. It should be considered a collaborative activity where gaps in understanding can be bridged through data co-interpretation. And the intermittent visits and constant home care is recurring amongst many chronic illnesses, so it's important to design technology that can understand and utilize info from both spheres to provide care. Alternative models of care, such as the video conference calls and remote data collection, have been shown to support adherence to treatment amongst patients, but there's still a scarcity of studies done on remote care in CF, and efficacy outcome is mixed. But of course, these findings can't be applied to all CF patients in any context, but the benefits will be worth it if changing the structure of care in CF patients is indeed improved via technology.
The aim of the study was to gain an understanding about the personal experience of patients with CF as well as the experience of professionals that care for patients with CF. This was done in order to properly develop technologies that care for both parties. Within this study, clinical observations were made using semi-structured interviews with patients and multidisciplinary teams, as well as using clinical consultations. The interviews allowed for researchers to gain insights on the patient's everyday experience and challenges. In order to gain insight on the professional perspective, researchers spent time in the multidisciplinary team office. To get more in-depth understanding of the experience with cystic fibrosis, interviews were conducted using open-ended questions. In using an open-ended question format, there are no cognitive restrictions placed on the patient. The patient was able to answer all questions in a stream of consciousness format, allowing for the interviewers a better chance of getting essential information about patient experience with cystic fibrosis. They asked about the experience with living with cystic fibrosis, experiences in clinics, and thoughts on technology and how technology can change the way they're cared for.
Cystic fibrosis results. Now, cystic fibrosis is a time-consuming matter, which means that the patients have to spend a lot of time on their medication, exercise, and juggling their work and daily lives. Now, problems with the clinics is that it is also time-consuming, which they can spend hours on end for an appointment, and they risk cross-contamination with someone else. Now, how can technology improve it? Well, technology and remote monitoring can give constant care and give them early detection for some who need it. Now, the patients wouldn't need to go in, which will save a lot more time, and I found this interesting because technology can remove the massive time burdens from cystic fibrosis patients, and it's important because it can save time and lives.
Today, more and more hospitals and clinics are providing telehealth across the country. Reasons for this change may include staffing challenges, medical costs, and administration access. Although it is becoming more common as rural areas need health providers, it is not without flaws. For the most part, these telehealth providers believe that only around half of all providers are really prepared for this type of challenge. In order to provide virtual care, it is important to have a stable and secure network that allows for video calls in real time because any lag will put emergency patients in grave danger. One such virtual emergency room in Sioux Falls, South Dakota specializes in emergency medicine that provides care to over 179 hospitals and undergoes 15,000 responses a year to the most rural areas in America. Although this program has saved hundreds and thousands of lives, it still won't be the same as having a physician physically there to operate. I think in the future there may need technologies that allow physicians to have more presence in the virtual world, which allows them to operate through machines and not just through nurses.